Welcome to Care Sector Update. This episode looks at the funding model for adult social care being followed in Germany, which has proven to be more financially and politically sustainable than England. I'm joined by Tony Stein, Chief Executive of Healthcare Management Solutions, which currently manages around 75 care homes, and our special guest is Professor Caroline Glendinning, Emerita Professor of Social Policy at University of York, who co-authored a paper in 2018 entitled "What Can England Learn from the German Approach to Long-Term Care Funding?" So, Professor Glendinning, let's start with that question. What can we learn?
Well, if I can give you a bit of background, the German system is based on some very clear principles. And one of the things I would want to argue is that we should follow those principles. So first of all, that the need for care at any age is a universal risk that requires social protection. Secondly, it's characterized by a single, strictly ring-fenced fund, and contribution levels and benefit levels are controlled by government. Thirdly, and perhaps most important, it's universal. Everybody contributes, everybody has the potential to benefit. Fourthly, it promotes autonomy and choice. And fifthly, there's a standard assessment of needs. It doesn't depend on your income, how much property you own, where you live, what your diagnosis is, whether you've got a family carer. And I think those principles are really, really important ones that should underpin funding reform in England.
It is interesting to listen to those principles because they are the fundamental principles of healthcare rather than social care in Britain, and what the NHS does. But the German government, as I understand, or the German system, requires an insurance-based funding model. So tell us how that works.
Right. Okay, so anybody who has a care need is assessed on a standard assessment process, standard assessment schedule, and the amount that you get depends on your assessed level of need. There are 5 levels of what the Germans call care dependency. The assessment and decision making is independent of the long-term care insurance funds, which, if you like, act as purchasers, as commissioners of care. The assessment is apparently relatively unproblematic. 75% of assessments are not challenged. There's no appeal. People don't wish to appeal their decision. The level of the benefit that people get is also dependent, though, on whether or not you take your benefit as a cash payment, a monthly cash payment, or as a monthly allocation of services. So the cash payment option, strangely, is much lower than the service option, but it's always been much more popular. It's still well over 50% of people who qualify for care insurance prefer to take the cash benefit, particularly people who are receiving care at home. The current levels are around £283 a month, which is a cash payment for the very lowest level of care dependency. But going up to...
That's sort of similar to the carer's allowance, isn't it, that the government pays, the caring benefit.
Yes, indeed.
Attendance allowance.
Goes up to about £1,700, £1,800 a month for the service entitlement for people at the highest levels of dependency. I think it's also important to mention that people who are eligible for care insurance are entitled to a number of other benefits, and those benefits primarily designed to support family caregivers. So built into the German system is support for family caring, and I think that's another important message to take away and think about in the context of reform for England. So, for example, additional benefits are 4 weeks a year paid respite care, substitute care for a carer to have a break, retirement insurance cover, pension cover for family carers, nursing advice and training for carers, and more recently, entitlements to leave from work for family caregivers.
So, Caroline, this all sounds very attractive, but at what age and what point in their lives do German citizens have to take out the insurance?
It's compulsory everybody who is in employment contributes, and anybody at any age, and I think this is really important, not just older people, working age people, and indeed severely disabled children can also benefit from the care insurance. Contributions are not that high. They were initially introduced at 1.7% of people's salaries. It's now gone up to 2.55% of income. The contributions are split between the employee and the employer. Interestingly, in order to encourage employers to carry this additional contribution, employers, the trade unions agreed to give up 1 day a year of statutory bank holiday, if you like. So that was the deal.
Okay, Caroline, sorry, I'm not going to interrupt you too much, but the time is pressing. But
Sure.
Tony, you've heard what Caroline has said. As an operator in the field, there's a complex set of benefits, but very holistic as well. Do you think that having it funded in the way that she's described would be something you would be prepared to have all the relevant administration to facilitate?
Yes, I think there's some interesting parallels between what's happening in Germany and what happens over here, and some interesting contrasts too. The first of those is that Germany accepted, because they understood this to be a universal need, that social care should be a responsibility that's funded by effectively increased taxes. I mean, and at the end of the day, we have to understand that we have a lower tax rate generally in this country than overall. So effectively what the Germans have done is they've basically said, in order to fund this universal need, we have to increase tax.
Okay, Tony, we'll pause there for a moment. Caroline, can I just go to one other point, because we're running out of time. I'll give Tony the last word, but you've got such a lot of interesting facts, it's difficult to constrain you. What is your view on the contrast between the system you've just outlined and the prospect being ventilated in the media recently of a very simple system in Britain of a £50,000 cap in England?
As I said, I think it's actually not that simple. First of all, it does not put any more money into the system. And Tony has pointed out that actually we do need to think about how we're going to raise additional funding for that. I would want to argue that an increase in national insurance contributions, ring-fenced, and perhaps called something like a National Care Solidarity Fund, could mitigate some of the kind of political concerns about raising taxes. OBR has estimated that a 1% increase in national insurance contributions could generate up to £14 billion additional income. And you put that together with the current revenue funding that's going into social care, it's a very significant increase in the funding available for care. And I think the ring fencing is also important, because it's about saying to people, okay, pay a little bit more money, but the money, the care, the support that you need will be there when you need it. And I think that's also very important for providers, because it's about ensuring that providers have security and stability and know that money will be forthcoming in future.
Tony, we've got 30 seconds at the very most less. If you had to choose, which would you go with? Caroline's choice there.
Listen, I think we have to say this. One, the German model was based on a federalized sets of rules, which I think in this country we definitely need. Yeah. We need to centralize social care. And the second thing is it's hypothecated. I love it. The third thing is it encourages families to care for their own, in the sense that it does offer that cash alternative to families to use the money that they're entitled to. I think there are so many good things about it, but the bottom line is it needs more money. That was done through increased taxes, and it was centrally led. And I think all of those things need to play a part in any future that we have for funding in this country.